Disponible pour des questions des médias, nous accueillons Mayor le maire Jim Watson. Phoning in, we have Councillor Keith Egli, Chair of Ottawa Public Health Board, Conseiller Keith Egli, Président du Conseil de santé publique Ottawa, City Manager, Directeur municipal Steve Kanellakos, Dr. Vera Etches, Chief Medical Officer of Health, médecin-chef en santé publique, Anthony DiMonte, General Manager of Emergency and Protective Services, Directeur général des services de protection et d'urgence. Phoning in, we have Donna Gray, General Manager, Community and Social Services Department, Services sociaux et communautaires. Phoning in as well, we have Wendy Stevenson, Chief Financial Officer, Chef des Finances. As well, phoning in, we have Chief Peter Slowly, Ottawa Police Service, Chef Peter Slowly du Service de Police d'Ottawa. And as well, phoning in, we have Dean Lett, Director of Long-Term Care, Directeur des soins de longue durée. I will quickly do a roll call to see which agencies are on the line. If I have missed anyone, please let me know. Je vais maintenant confirmer les noms des médias qui sont en attente. 104.7 Outaouais.
1047 Outaouais.
Jason White.
Here.
Thank you, Jason. CBC, Joanne Chianello.
Here.
Hi, Joanne. CTV, Josh Pringle.
Here.
Le Droit.
Le Droit, Julien Paquette. Here.
Fred Sherwin. Ottawa Citizen, John Willing.
Hi, Kina.
Hi. Ottawa Sun, Elizabeth Payne.
Yep.
Thank you. Radio-Canada, Gilles Taillon.
Radio-Canada, Gilles Taillon. Radio-Canada, Gilles Taillon. Are you on the line? Yes, I am. TVA Gatineau, Ottawa, Étienne Malouin. Is Étienne Malouin on the line?
Guccione.
Yeah, I'm here, thanks.
Thank you. Nous allons maintenant répondre aux questions des...
We'll now answer questions from the media. You'll have one question and one follow-up.
Media can ask one question and one follow-up. We'll begin A to Z for today, and next time we'll do Z to A. We'll start with 1310 News, Jason White.
Hi there. My question is regarding the preparation for once all of these restrictions start to be lifted. I believe, Mr. Kanellakos, you referred to so as it being so that the city isn't caught by surprise once the federal government and provincial government start lifting restrictions. Can you detail a little bit more what needs to be done from the city's perspective to prepare for reopening the economy? What does that involve and what does that look like from your end? What sorts of things are you doing to prepare for down the line when these restrictions are lifted?
Steve and I are collaborating very carefully on making sure that the priority is the safety of the population. And so I'll just start and he'll address the city specifically. We know that this is an area where federal and provincial guidance will be critical, and we'll follow that with some decisions to be made at the local level. And what we are also very conscious of is that we need to have everything in place that enables us to proceed safely. So signs that the infection is declining in our community, evidence that our healthcare system is ready to cope, including the protection of our vulnerable long-term care home and retirement home populations. We need to have a surveillance system to be able to monitor how much infection is in our community, and a testing and contact management, case and contact management program to follow up in a very targeted way to make sure we stop transmission in our community. So these kinds of criteria that we need to have in place is, that's what we're working on. And then, following along with the province, the guidance around increasing activities that will bring a risk as we open up different activities, a risk of transmission of the virus in our community again. Most of the population is not immune to this virus, and so we need to proceed carefully.
Thank you, Dr. Etches. And what I would add to that is that there are many things that we do that are enablers to economic activity. And one of the things, I'll give an example, is childcare. And that's something that the province and the federal government is very interested in, because a lot of people can't reintegrate back into their jobs and into the economy if they don't have proper childcare. Ultimately, schools will be a big factor in that. And our end, transit is going to be a big issue in terms of people getting back on buses, back on trains. How do they social distance? So we have to start thinking as we anticipate what sectors are going to open up in what order as the provincial government announces those things. We have to anticipate our services and what things do we have to do to protect our staff, whether it's personal protective equipment or the signage or the rules or the thing that communication we put out to the public, and how is the public going to have confidence so they can enter into some of these systems and services and be safe. And so we're starting to think about all those things, and the easiest example I'll give is what the grocery stores have started doing because they were allowed to stay open. You know, the tape in the floor, keeping people separate, the plexiglass between cashiers and customers, people going around to make sure that people stay separate, the unidirectional movement through the stores. We've been talking about all those things for our facilities, for our services. And then on top of that, we have a function to regulate, to inspect, to give permits. Many industries require city inspections, require the city to sign off on their work and their permits, et cetera, particularly in Mr. Willis's department. So how do we get those people back out into the field to make sure that many of our infrastructure projects, private sector, public sector, are still operating? So we are working our way through all the various scenarios and what the prerequisites are so that we either have supply chain nailed down in terms of personal protective equipment, or signage ready, or buildings fit up that are ready, and the tape on the ground that's ready. So we start doing all those things so that we don't get caught short. The announcement comes and we can't participate because we haven't done the thinking, and we have to do it post the announcement.
Thank you. Do you have a follow-up, Jason?
I do. On the economic side of things, as it pertains to the city's finances, I've been monitoring the meeting through the day, but obviously we're all doing 2 and 3 jobs right now. Can you talk a bit more about the financial effects and how far out you expect this to ripple time-wise? Like, how long is the city expecting that this pandemic will affect the city's finances? How far into the future? Are we talking a few months? Are we talking the rest of this year? How much of an effect is this going to have on 2021? Do you expect at this point?
Yes, we've our city treasurer laid out 3 scenarios we're working from. The first one is to the end of June. The second one is into September, and the third one is to the end of the year. Right now, the most likely scenario we're working under is till the end of September before we start seeing things ramp back up. That's because we also anticipate, you know, with summer coming, a lot of people won't be here, and it's usually a quieter time in Ottawa anyways. And so we're thinking that our revenues will be affected until the end of September. But the impact will carry into 2021. There's no question about that. Council will have to make some decisions with the mayor's leadership in terms of what is our fiscal framework going to be, our long-range plan going forward into 2021 with respect to property taxes, with respect to increase to fees, with respect to inflationary increases in terms of our costs, in terms of projects we have going. We are going to have to look at all those things, because if the revenue shortfall carries into the end of the year, even into the third quarter, we're going to have to make adjustments into 2021. So we're looking at this as a problem through the next 18 months that we're going to have to manage as an organization to make sure that we balance our revenues and our expenditures.
Thank you. We'll now move on to Joanne Chianello at CBC.
Hi, thanks. This is a question. My first question is, I guess, for Dr. Etches, but anyone else as well. The province, as you said, they told you last night, but they announced this morning that they want COVID testing in all long-term care facilities in Ottawa. And I am wondering if you can address whether the healthcare system has the capacity to do that. The people, the supplies, even the lab testing capacity it seems like that's a lot of people we want to test suddenly. So if you could address that, Dr. Etches, thank you.
Yes, so we are going to follow the provincial direction locally in Ottawa to make sure that the surveillance testing that they're interested in is carried out. It will require a coordinated approach with our healthcare system partners, with the long-term care homes themselves, but it is a joint effort. It will require people to take the swabs. It will require a coordinated approach at the labs so that we don't overwhelm the capacity of the labs such that those important tests that need to get through, for healthcare workers, for people in hospital, that those can still be processed. And so this is what we're looking at today, is how we can plan this in a way that allows it to move ahead as effectively and as efficiently as possible.
Thank you. Do you have a follow-up, Joanne?
Yeah, I do. Actually, I wanted to ask Mayor Watson, you said you spoke with the Premier last night. What can you tell us about the conversations you had and the kind of feedback you're getting from him? Thank you.
Yeah, we talked about, he wanted my advice and comment on, when we should start opening up segments of the economy, because obviously he, like I, are feeling the concerns and listening to the concerns of a number of businesses that are obviously starving and doing not so well financially. And we talked about, the key element really is to make sure that we don't rush into opening the economy or segments of the economy too soon. And then we're hit with a second wave of COVID-19, and then we have to backtrack and start closing those businesses again and laying people off. So I think both he and I are of the same opinion that we should be doing this very cautiously, and it should be staggered and staged so it's not all at once, so it doesn't overwhelm other public services like transit and daycare and so on. And I also asked him about a couple specific issues, as I mentioned at Council today, with respect to allotment gardens and the importance of allotment gardens, particularly to economically challenged neighborhoods. And as I said earlier today, he was quite sympathetic to the fact that if we can, manage opening up the gardens from a physical distance point of view and a safety point of view, then obviously he would certainly look at that, and he committed to bringing that back to his cabinet table. So I thought it was a good exchange, and I think we're both on the same page with respect to we want to see the economy open, but we don't want to rush into it and get ourselves into a bigger challenge when we end up having to reclose businesses and relay off people, which I think would be pretty horrific for the spirit of the individuals and the greater community. Thank you.
Thank you, Mr. Mayor. We'll now move on to Josh Pringle at CTV.
Good afternoon. CTV has heard that Parks and Recreation staff have been asked to help PSWs at the city-owned nursing homes. Can you confirm that this is happening? And if so, what are city staff doing to help out in these homes during the pandemic?
Yeah, maybe I'll ask, I can answer, but I think Donna Gray is up to speed in terms of the latest redeployment strategy that we're undertaking for the long-term care. Donna, are you on the line?
Yes, I am. Thank you. Yes, so we have, as part of our city redeployment plan, been looking at most urgent redeployments, and obviously our long-term care homes, for a variety of reasons, are areas that we want to ensure actually are staffed and have support to do the essential work that those groups need to do. And one of the areas the team identified first off is two areas, actually. The first was that we're recognizing that the seniors in our long-term care, that their physical and their mental health, in order for them to stay healthy, they need to be connected to families and loved ones and friends. And we recognize that that has been an increasing stress on those individuals in the homes and the families themselves. So we do have a position in the long-term care homes that is making direct contact between residents and their families for a variety of things, whether that be emails or through Skyping or electronic devices, so that people can stay connected to their families. And so Parks and Recreation they have a group of staff who, because of the programming right now, are not currently working in the centers. So we did a call out for volunteers of people who would be willing and interested in working in the long-term care. So we currently have about 20 positions that will be staggered over the homes to come in and to be able to provide those supports. And additionally, we're also looking at those functions, potentially doing some feeding of individuals or moving individuals from room to room to be able to assist with some of our professional staffing.
Thank you, Donna.
So just to follow up.
Go ahead, Josh.
Are they helping now with the feeding and moving individuals, or is that something that you're looking at further down the road? Right now, just sort of going in to help and provide support, and that's the next step.
Yes, right now they've been identified and they're just in the process of training and coming into, there's a significant amount of just training and readiness to bring them into that facility, but they would be doing both functions.
Perfect, thank you.
Thank you, Josh. Maintenant, on ira à Julien.
Julien Paquette from Le Droit. Yes. I think that Mr. Kananakis in English mentioned the need for the board to take decisions in the coming months to deal with the financial impact of the current pandemic. He also mentioned the possibility of increasing property taxes 2 weeks ago. This was something that he said that was perhaps possible. Mr. Mayor, could you perhaps comment on that? Is it still a priority for you to avoid a tax hike because of this pandemic? Answer. Well, it is a priority for me. Now, today, there are many members of the council who expressed their concerns about possible tax hikes. So there are many people who've lost their jobs in Ottawa. So what we need to do now is to really help them deal with their situation. We don't really have a number yet. The process will be kicked off over the next few months when we start looking at the budget and drafting the budget. But it's quite possible that we not start drafting the budget in September, October, but that it be delayed because we might not have all the information we need. We won't have information on possible subsidies from the various other levels of government. We're in a situation of flux for the time at this current time, but it's important for me to really keep a handle, keep taxes and expenses under control. The follow-up question for you, Mr. Mayor. You've decided to delay the decision of replacing the Cumberland ward councillor. Does that mean that the council will actually want to hold a by-election? Well, it's a very tough situation we're in. It's a unique situation in the history of the province of Ontario. I don't think it's a good idea to hold a by-election right now. It's not a good idea for candidates to hold public meetings and to be doing door-to-door canvassing. So the clerk suggested today that we defer our decision. We will take that decision probably in the next couple of months. We'll have to see how the pandemic evolves, and I think that the council will want to make a decision at a later date. Will we hold a by-election? Well, if the health situation is good, it would be my preference to hold a by-election. But if the situation has not evolved, if we're still in the same situation we're in today, well, I don't think it would be a very smart idea to really hold a by-election during a pandemic. Now, the other option we have also is to interview candidates, and then the council could choose the winner. But for me, the priority would be to hold a by-election at some point. But at the same time, I think it's necessary for us to understand that now, during this crisis and during the budget development phase in September, October, the residents of Cumberland don't have a voice. So this is another thing that will come into our decision, which will factor into our decision of whether to hold a by-election or not. The reason we actually adopted or passed that resolution today, moved by Councillor Luloff and seconded by Councillor DeRose, well, it's because it gives us more time to actually clarify the situation over the coming months. Thank you.
Merci,
Mayor,
Julien.
could you please give those answers in English? Would you mind? Thank you.
Yeah, it's a very unique situation, Joanne, that we find ourselves in with the by-election. Obviously, on the one hand, we want to make sure that the people of Cumberland have a voice around the council table, particularly during this pandemic and as we head into the budget process over the course of the next couple of months. But at the same time, it would be irresponsible for us to hold a by-election in the middle of a pandemic. Obviously, no one wants candidates going door to door, and you couldn't have any gathering of a rally or an all-candidates meeting. So the motion today was really to give us a little bit more flexibility to determine the lay of the land in a couple of months. And if the pandemic is behind us and the medical officer of health gives us the go signal that we can actually go out and have a by-election, then obviously we would hold that as quickly as possible. If we find ourselves in the same situation in September and October, and we're still in the midst of this pandemic, which I hope we're not, but if we are, we'll have to make a decision of whether to prolong that by-election or to appoint someone through a nomination process similar to what's been done in the past, for instance, at school boards. My preference, obviously, first and foremost, is to allow the people of Cumberland to select their own person as their councillor. But at some point, we have to make a decision that do we continue to keep that seat open without a voice at the table and wait month after month until we get the all-clear signal that the pandemic is over and people are free to go door to door and campaign like they would in a normal election. Thank you.
Thank you very much. We'll now move on to Fred Sherwin at Orleans Star. Are you there, Fred Sherwin, Orleans Star? Okay, so we'll move on to John Willing at the Ottawa Citizen.
It's a question for either Mayor Watson or Steve Kanellakis. Have you heard anything more about whether construction timelines of Stage 2 have been shifted or altered in any way at this point?
No, I think John had spoken about that, Manconi, about that before. They have obviously are concerned about their timelines, supply chains and the rest, and their productivity isn't exactly where they want it to be. But it is a 4-year schedule plus. They think they can make that up depending how long this goes. So we don't have anything right now from them formal saying that they want us to adjust the timelines or declaring anything under the contract looking for relief. But they have signaled to us that it's a watch item for them. And Mike Morgan, who's our Director of Rail Infrastructure, is out there checking, and he says work is still progressing on all the lines, and they're still moving ahead. So we have not, we're not in a position right now to come to a conclusion about whether they'll be impacted. Like all these things, it depends how long this goes and how the economy starts opening up.
Thank you. John, do you have a follow-up?
Yeah, just a related question to that, Steve. Has there been any indication by fixed-price contract holders that they will be seeking more funds from the city for the work under like any contract divisions that might speak to force majeure incidents? And I'm wondering if the city does consider the pandemic a force majeure incident.
Are you referring, John, to light rail or infrastructure projects in general?
Certainly, Steve, light rail, but any infrastructure projects in general too.
No, we've talked to our lawyers in terms of whether someone can request or claim a force majeure, but we have not had that. We have not been formally advised by any of our contractors that in fact is what they're planning to notify us of.
Thank you.
Thank you. And now we'll move to Elizabeth Payne at Ottawa Sun.
Hi, thanks. It's a question for Dr. Etches, again on testing. Do you know approximately how many or what percentage of long-term care residents and staff of Ottawa have been tested at this point?
Thank you. The testing to date has been related to detecting outbreaks and controlling outbreaks. And so if there was one healthcare worker that was positive or one resident that was positive in a home, then we would test all of the healthcare workers related to that outbreak. And we would test the residents in the home that were symptomatic, all of the symptomatic ones, as well as anybody who was asymptomatic in close contact with that resident. So I don't have all of the count of the negative test results, but we do have the test results of those who have been positive in those settings. So I believe so far among the outbreak situations, we have 247 lab-confirmed cases among Ottawa residents and staff, and 21 associated deaths within the long-term care homes or retirement homes. So that is just the positives. The team would have more information on that if you'd like all of the tests that have been done. We are trying to of course, add up everything and make sure we have a list of everybody who needs to be tested, and that's part of the planning and the coordination going forward so that we do complete the exercise.
Okay, and just to follow to that, that is a small proportion, is that correct, of everybody you would now have to test? Do you have any sense of what you're looking at? Have you done 20% of everyone, 10% less?
Yes, I can't say right now. I don't have those numbers, but that is part of what we need to map out. Certainly, it is a much larger number that we are going to be following the ministry guidance. It looks like we're waiting for details on that and how the province would like us to roll that out. But we will be building on what has been done around outbreak detection and control. This work that the province is discussing is more like a surveillance program, and we'll be continuing, of course, the work around outbreak control as well.
Thank you very much. Maintenant, nous irons à Gilles Taillon.
Gilles Taillon, Radio-Canada. Hello, my first question is for Dr. Etches. The city seems to be looking at a return to normalcy, a normal municipal operation starting in September. Do you think this is realistic? Do you think it's plausible? And what are the conditions that have to be met for you to reopen in September? It's not my decision alone. It's not my decision to actually lift the current restrictions designed to control the transmission of the virus. It's really the province that will set out the guidelines. But for me, it's important that the province develop a process to protect Ontarians' health, especially those who are the most vulnerable among us. There must be measures in place, such as the right resource level in the healthcare system. There also has to be a surveillance system so we can really get a handle on infection in our community. There has to be a contact follow-up system as well that's put in place. But what's just as important is the buy-in from the community. There has to be a process which is clear and easily understandable by the community. What are the priorities? Those have to be made clear to ordinary people. So if anybody else from the city has any other comments, I would ask them to step in, but I can't say definitively that we will be opening up again in September. I hope I have answered your question. Well, Gilles, what the city manager has said is that we're looking at various scenario for June, scenario for September, and a scenario for the end of December. Now, what he also said is that we have work groups, task forces that have been set up to actually reopen the city based on the green light from the province and from the federal government as to opening up specific sectors within the city. Now, the city has to be ready. We have to be ready in terms of public transit at other levels so that we're not behind the eight ball. These are the preparations that we're doing, and we don't know yet when we'll open. We don't know if we'll be able to open in September, but we'll have to follow the advice from Dr. Etches. As she said, we have to make sure that hospitals are ready. Are we seeing a decrease in the number of cases? There are several things that are being analysed. So this is what we're doing. We're analysing to see whether we're ready for September. And if we are, we'll take the steps we need to put in place really to open up. But it really depends on the decisions made by higher levels of government. My follow-up question is for the Mayor. Mr. Mayor, hello. We've learned that the city is spending $24 million a day, and a deficit is predicted. Given that a lot of the city's budget really is taken up by workers' salaries, are you looking at that? Are you looking at possible reductions? Well, all options are on the table. I think it's the responsible thing to do. But for the time being, we have the capacity to deal with the situation, because we had a contingency fund, we had reserves. We've laid off 4,200 people a week ago. That was a tough decision, but it was necessary. The third thing is that we have placed a freeze on new hiring for the next few weeks and months. At the same time, we're working with the other two levels of government because we must be able to reach out to them to get financial support for projects such as major infrastructure projects, transport projects. And Mr. Trudeau and Mr. Ford's governments have been very, very positive. We haven't yet reached an agreement. That's half of the solution, at least, for all municipalities. Subsidies from the two other levels of government are important. At the same time, we are looking at cuts here at the city as well. Thank you. Thank you very much. Etienne Malouin from TVA, are you on the line? No.
Last but not least.
Yeah, my question is for the city manager. Steve, I wonder if you could expand a bit on what Steve Willis is working on, what his work. I think you mentioned at the last council meeting and again today that he's looking at all the infrastructure projects and some may fall off the list. Did I hear that correctly?
Well, Steve's looking more. We've got the four task forces. One of them's on services, which is Dan Cheney, who's looking inward, Pat, to our own services and how do we get up and running. And then Steve's looking out. And I'll give you an example. We were on a call the other day with senior federal public servants, and we were discussing, how can we work together to ensure that, for instance, we don't have peak rush hours for our transit system? And is there a possibility to look at, staggering work shifts, at least in the short term, until we get back on our feet, so we don't overwhelm the system? So Steve Willis's role is to continue those discussions, is to look at all the things in the city that we provide as services that the private sector needs for them to be operational, and the obvious ones, as I mentioned, were construction and inspections and permits and road cuts, and all those big infrastructure pieces is just one piece of it that we do. And Steve is also looking at from the big project priorities for the city. We just council just passed a strategic plan when we passed the budget, and in that strategic plan are a list of priorities that council expects us to move on, and some of them are big policy decisions. We're still moving forward on the official plan, for instance, but the Transportation Master Plan, which is a big piece of work and is critical for our future, is really dependent on data on people's travel patterns, and I don't think our consultants can do the study that we need to input into developing strategies and thinking through what our transportation needs are going to be in the future when we have an anomaly, an aberration right now in the system. So Steve's looking at our entire legislative agenda, all our big projects that we have on our capital projects that we have underway, which ones are going to be affected by our vendors not being able to deliver on the work in the time frame that we have, which ones have to be put out later, which ones haven't tendered yet, maybe we want to wait because we want to preserve our capital funding for something else. What's the federal government, provincial government going to do, as the mayor said, in terms of supporting us with infrastructure dollars? So Steve is trying to figure out how are we best positioned to support the business community and private sector, and he's also trying to figure out what do we have to do internally to make sure that we have the capacity to be able to do that, provide that support.
Thank you. Do you have a follow-up, Pat?
My follow-up question is for Dr. Etches, and it's really sort of following up on what Elizabeth Payne was asking. I think you mentioned at the council meeting today that if there's not an outbreak at a seniors residence or a long-term care center, that you're not testing all residents. Did I hear that correctly today?
No, I don't think so. That has been the case, that when there's not an outbreak declared, the focus is on detecting the outbreak, so looking for people who have symptoms of illness, whether they're residents or staff, people with atypical symptoms. What is shifting is based on provincial guidance that came down last night, early this morning, and that will change the approach to testing where there is not an outbreak. It'll be a surveillance exercise, and we're waiting to have more details on how the province would like us to undertake that, and we're starting to coordinate a plan locally with our healthcare partners to be able to have the capacity to undertake this as effectively, as efficiently as we can.
Thank you very much, everyone. Merci à tout le monde. This is all the time that we have. C'est tout le temps que nous disposons aujourd'hui. Have a great day. Bonne journée.